Yeah, this time of year, many teens and young adults, they're leaving the nest, whether it's for university or they're starting work. They may find themselves navigating challenges of living on their own for the very first time. And many, I would probably have been one of them, don't really know where to turn for medical advice. So how can we prepare young people in our lives to take care of their own health? Family physician Dr. Danielle Martin joins me now with the answer. It's great to have you.
Thanks, Kelsey.
I think this is really relevant info this time of year as young people are heading out on their own. You say teaching young adults about their health starts with their mindset first. So what do you mean by this?
Well, and of course, it starts long before, Labor Day. It starts as they're getting older. We're always increasing their responsibility, right? And so thinking about health as more than just taking care of yourself when you're sick, but all of those things that we know are important around routine, sleep habits, healthy eating, exercise. These are things that are not just relevant to those of us who consider ourselves adults, but to young people their whole lives. And the more that they develop that sense that they know how to take care of themselves and have a routine, the better they will feel, the better prepared they will feel for setting that routine for themselves, which is so important for their physical and mental health once we're not around to set the routine for them. Another really important thing for young adults is to increase their responsibility as they get ready to head off to university or college or wherever they're going around managing their own symptoms when they're not feeling well and knowing when to reach out to a healthcare provider when they're not, when they can't handle it for themselves.
Yeah, would you say that's one of the biggest challenges young people face when it comes to navigating their own health, finding a physician or whatever else it may be?
I think it's finding one, but also knowing when to ask or when to look, right? And so when I have a headache, what do I take? Am I taking Tylenol? Am I taking Advil? Do I know what the difference between those things is? Do I have any around that's not expired? If I, am going on a long bus trip to a tournament, do I need Gravol for motion sickness? Do I have some? So, those basic things about managing your own symptoms, many of us as parents just hand the pill to the kid and tell them to take it instead of helping them to learn how to manage those basic symptoms for themselves. And then when I'm feeling really unwell and I have a fever, that's a time to reach out and ask for assistance. And where do I go to do that? So that's the kind of thing that in advance, knowing where services are available in that new community, where to call and what to do is a really important part of all of this. And that stands for, of course, both physical and mental health concerns.
Listening to you speak, I'm realizing this is not just a conversation for young students and people living away for the first time. This is a conversation for our families who have teenagers who are still at home, who are in those latter years of junior high or high school, prepping them now so that when they move away, this is not new information.
That's right. These things should never be an event. They should be a process, right? And so much about raising kids, as we all know, is slowly increasing that responsibility and giving them the capacity and the confidence in their own ability to manage themselves, and then knowing when they're beyond that place where they can help themselves and when to ask for help.
So you're a young adult, you've moved away from home, you're not seeing your family doctor anymore. What's next? Do you go to the on-campus clinic? Do you find a family doctor, even though you're only there temporarily and for part of the year? What would you recommend?
Yeah, so usually for young people who go off to school, I actually recommend that they keep their family doctor at home. We all in the pandemic got more accustomed to the use of virtual care, and that can be appropriate if you're in the same province, especially, or the same part of the country. So continuing to use virtual care for things that are not urgent and booking visits preemptively for when your kid comes home to visit. So you're coming home in December for the holiday season, helping your kid to book an appointment with that family doctor so you stay in touch, renew prescriptions, that kind of thing, and then knowing where on-campus services are so that if you've got strep throat, if you need to have a conversation about sexually transmitted infection, if you're having a mental health crisis, your kid is aware of what the resources are and where to go. And of course, there are lots of really good online resources too. I don't tend to recommend trying to find a local family doctor for a kid who's away purely for the purposes of going to school and who's coming home at the holidays. It can be hard to do, and that's what student health is there for.
I'm so thankful that you're in studio this morning. Starting those conversations early with your family makes this less of a big transition, and your information is so helpful. Doctor, thanks for being here.
Thanks for having me.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.